Welcome to the Stronger Than Autoimmune podcast. As an autoimmune warrior myself, I understand living with chronic illness isn't easy. You're not alone. This podcast was made to bring hope. I will interview individuals living with autoimmunity along with businesses and experts to provide knowledge and support. As an autoimmune coach, I understand there is no cure for autoimmune disease, but lifestyle changes can influence how we feel. So join me on being stronger than autoimmune. And shout out to all the listeners out there, because without you, this podcast would not be possible. So how can you support the podcast? I'm glad you asked. There are 3 ways to support the podcast. 1, rate on Spotify. 2, review on Apple. 3, share with a fellow autoimmune warrior so they too can have hope and be stronger than autoimmune. So let's get started. Guess who I just connected with, warriors? Leap Cure. Leap what? Leap Cure. Leap Cure connects patients with clinical trials to make research more equitable and efficient. Listen to their latest clinical trial.
If you've been diagnosed with thyroid eye disease and are seeking potential new treatment options, you might be interested in the LIDS clinical trial. If you're 18 and over, have a diagnosis of Graves' disease or Hashimoto's, and are interested in potentially participating in research, you can fill out a short questionnaire at lpcur.com/TED. You'll be connected with someone on the team to determine whether it might be a good fit for you. Check your eligibility and learn more at lpcur.com/TED.
Hello, warriors. On today's episode, I speak to Hamish Edgar, a reflexologist and mental health nurse in South Yorkshire, United Kingdom. He worked all of his life in the field of mental health. He began to develop reflexology approach to mental health problems called Limbic Reflexology. He teaches Limbic Reflexology, and since 2018, he developed a course online. And also let me introduce you to Marcia Edwards, a reflexologist and first aid for mental health instructor. She became a reflexologist in 2013 after 25 years in IT. Her other certifications include functional reflex therapy and limbic reflexology. She passionately provides the community with tools of reflexology. I brought them both on the show to discuss chronic illness, mental health, and reflexology. So let's get started. All right. Thank you so much for joining me on the Stronger Than Autoimmune podcast. I have the pleasure of having Hamish and Marcia to talk about the connection of mental health, reflexology, and chronic illness. So thank you so much for your presence, Hamish and Marcia.
Welcome. You're welcome.
Be here.
Before we get into this triangle of connection of mental health and reflexology, can we establish what reflexology is for people that don't know?
Right. So I'll start. There's 2. I'll say both myself and Hamish are members of the Association of Reflexologists, but I will sort of say what that is. And reflexology is a complementary therapy, so works alongside any medication in the sense that person is on. But it's a therapy based on the theory that there's different points, different areas on the feet, the hands, the face. There's also ear reflexology, and those correspond to specific areas or points, areas of the body. So it's a reflexologist will work these areas and on the feet or the hands or the face, and that aids relaxation, well-being, reducing stress. I like to think of it as I use my hands to help a person's body help itself. The body is amazing, and sometimes it needs a little bit of help. So I use hands and reflexology. There may be a reflexology balm or a cream that we use, but that's it. No tools, anything else.
So it seems like it's more of a I guess, more hands-on acupuncture in a way?
Not acupuncture, but certain areas and points that we would use, and sort of techniques how we would work with the foot. I mean, I usually work on a person's feet, and then I would show them on their hands what they could do when they're not working with, not with me. So
Okay.
I would do that as well. So.
Well, that's wonderful because that's needed, in between sessions.
Yeah.
You're giving them tools that they can use.
Yeah.
And Hamish, you developed the Limbic Reflexology system. And could you discuss what the limbic system is before we get into what limbic reflexology is? Just trying to establish the basics so people be on the same page.
When we're looking at the picture of the brain, what we're looking at is the cortex, which is the outside layers. There's 5 to 7 layers on the outside. But those layers are relatively thin. They're only millimeters thick. The limbic structures are the structures beneath that. So basically, they're the engine of the brain. Limbic literally means lining. So it lines the cortex. And the limbic system, the limbic brain, regulates. It can regulates all the systems of the body, and it determines kind of emotional, behavioural responses, controls all the endocrine system, controls the sleep or appetite, temperature, body temperature, and memory, and also responds to any pain. So it's in connection with the body, it interacts with the rest of the body, to the limbic system.
So it's almost like a communication back and forth between the body and the brain, almost.
Yeah, and there's a series of kind of feedback loops. It's all to do with keeping things working optimally, and the feedback loops. It's like keeping a balance. It's like if you think about walking along a tightrope, and it's constantly adjusting things within all the systems to keep it within that optimal range. So basically, the survival machine, basically.
Oh, could you say that again? It's like walking on a tightrope for what?
It's basically a survival machine. It keeps us within an optimal range of function. Okay, and if it gets outside that range, then that's when we experience disease or dysfunction. Okay, and that's what the limbic brain does. It interacts with all the body systems to keep it in balance. Keep it in balance. And the limbic brain's like that. It's constantly. It's never settled, if you know what I mean. It's always making fine tuning adjustments constantly throughout all the body systems, just to regulate and keep it within that range, which is an optimal range for functioning.
Yeah, I like the picture that you're setting up, being able to see the person walking the tightrope, and that gives a good idea of what people, that it's always going back and forth, the communication, adjusting.
Yeah.
And as far as how did you combine the limbic system with reflexology? I know your background is in your mental health background. So would you mind discussing what you discovered?
Well, I first turned to reflexology as something to do when I retired. And that was about 5-6 years before I retired, because I'm not one to sit around doing nothing. So I needed to put something in place for when I retired. So I trained in 2010, and it was towards the end of my training that I discovered some reflex areas in the big toe, which relates to the brain, that my tutor, no one else could tell me what they were. But that was having a huge impact on a client I had with anxiety. And I thought, well, if that one's there has such big impact, there must be others. And that's when I started looking to see what others I could find. So I started with the one. I think at the moment we're just over 30 limbic reflex areas in the brain. But 2013, I began training it. My tutor made me train it. She said, "You've got to train this." But when I developed it, it was with volunteers from a fibromyalgia support group in Wakefield, which was just about 15 miles up the road from me. Because I had a client that responded very well. She had fibromyalgia, and she responded very well to the treatments. I really didn't know what I was doing. I didn't know what reflex areas I was actually working. But the general rule in reflexology is you work what you find. Even though you don't know what it is, you work what's tender, what's disturbed, you work it. And she responded very well. In fact, it changed her life. And so I thought, well, it's obviously got a place in fibromyalgia at least. So I contacted the support team, and I spent all of summer of 2012 running up and down the motorway seeing these 8 volunteers. And I think 6 of them really had the same effect. So at the time, I didn't really know what I was doing, but we use outcome measures. And there's the standard outcome measure for fibromyalgia, which is used extensively worldwide. And that's how I measured the effects of this. And from that, I gradually worked out what I was actually finding, what structures it were. I changed them quite a few times because I thought, well, perhaps it's that. I thought, no, it's not that, because if it was that, they would have that effect. And eventually I worked it out what all these structures were. And over the years, they've been validated. They've been fine-tuned to quite a large extent, but been fine-tuned. And I'm pretty confident of what they are now. So, and the students getting the results, exact same results, helps validate that. So so it was quite a journey. It didn't set out as that. And of course, fibromyalgia is very much a mental health problem. When I was nursing in mental health, we got a lot of people referred for fibromyalgia. They were actually referred for depression, because depression and anxiety is a big part of fibromyalgia, as is any chronic pain condition. And what I did is I started volunteering at a local, what's called a recovery college. It's part of the NHS trust. Excuse me. And offered 8 weekly treatments to people living with fibromyalgia. And I've been doing that for 7, 8 years now. So, and that's made a huge impact. And I've actually get referrals. Well, it's not referrals because they refer themselves to the college, but they've been signposted. If you've got fibromyalgia, go and see Hamish at the recovery college. And that's from the NHS. So, and that's as far as into the NHS you can get, because they can't refer. So
I'm going to have to go across the pond to work with you, because I have fibromyalgia.
There you go. Well, you need limbic reflexology then.
Yes, I do.
8 weeks, 8 treatments, and you wouldn't know the difference. You will see a huge difference. I would say that, I know, but you will, and that's, as I say, it's consistent. And that's how Marcia got into it, because of the results she was getting in fibromyalgia. And in fact, on the training course that I run, one of the case studies should be with fibromyalgia, because it's one of the best conditions or problems. It's one of the best to learn limbic on. One of the best. And you're almost guaranteed to get a result. But it needs 8 treatments. It's a very specific treatment protocol. Needs 8 weekly treatments, or even 8 twice weekly treatments, so you can get better in 4 weeks rather than 8. But it's quite dramatic. Some of the changes quite dramatic. It gets people's lives back.
Yeah, yeah. I mean, I can't even imagine the before and after. Like you said, you know, you do the you have the data. You are able to look at the before and after and help these people feel. So, and I've seen that form where it's you're mentioning there more of a score at the end, right? Okay.
It is, yeah. It's the Fibromyalgia Impact Questionnaire, and
Correct.
it's used all over the world. So it's translated into God knows how many languages, but it's very much validated internationally.
Yeah.
And the results from limbic reflexology compare very, very favourably with other treatments offered for fibromyalgia who are using the same outcome measure.
Yeah. So what is the connection between anxiety and depression and fibromyalgia? What is that? I mean, obviously, I guess the horse is the depression, anxiety, and then after that comes a fibro.
Well, I mean, as you know, fibromyalgia is quite a complex problem. In reflexology in general, and specifically in limbic, we don't particularly look. Although people come to you with a condition, we don't treat the condition. I like to think it is treating. We break it down into problems. In fibromyalgia, you have problems with sleep, you have problems with concentration, you have problems with thinking, clear thinking, you have problems with depression or low mood, problems with anxiety, sometimes problems with can't tolerate loud noises. Okay, so we'll look at the problems, and the reason why that's helpful for us is because we can then target the neural systems in the limbic brain that regulate and control that. And of course, with the pain, there's very specific pathways in the limbic system that regulates pain.
That is amazing.
Depression, anxiety, obviously is affected as well. Because if you think of the brain, it's not that area deals with anxiety. That area, it doesn't work like that. They're all connected. And any dysfunction or any dysfunction in one area will impact on the other. So there's a cascade, further downstream, it's going to affect something else, which will affect the function of that. So
no separation. They're all connected.
They're all interconnected.
Shared pathways, shared networks. And that's why, as you said, you can't say, oh, this is pain, this is this and this. Or, if you've got, that's what I was saying about how your emotions, how you're handling stress, everything comes into that space.
Wow.
But in any chronic pain, and certainly in fibromyalgia, one of the main problems is a phenomenon known as central sensitization, which affects the pain matrix in the brain. And there's the pathways in the brain that is designed to deal with pain and to lessen pain. We've got our own opiates that the brain produces, endorphins, and there's a pathway that those function, and we can target that pathway, and we can tell which one is dysfunctional simply from feeling that reflex area. And you can tell when the beauty of it is when the pain subsides, you can tell by the different response in those reflex areas. Okay, so you can monitor the progress as you go along just by feeling the feet.
Wow.
I've used it so long now. I can feel someone's feet and tell if they've got fibromyalgia, even if they don't tell me. There's a pattern.
Really?
There's a fibromyalgia pattern. Yeah. In fact, there was a lady in Birmingham NEC who was working there she came in for this taster treatment, and I said, has anyone mentioned about fibromyalgia to you? She said, you haven't got fibromyalgia. I said, well, you didn't mention to the lady at the end. I said, oh, I did mention it. How did you know I got fibro? I said, I can tell by your feet. So it's a very distinct pattern, very distinct pattern. It's very similar to chronic fatigue syndrome with two signature differences. So it's that refined, you can tell. So yeah,
So
it's I love it.
Desiree, that's why, in a sense, with limbic reflexology, we're trying to get a research study, a proof of concept going, because limbic reflexology specifically for fibromyalgia, because that was the one where the results were, it was so clear, and there doesn't seem to be a clear management intervention for fibromyalgia. So this, seemed a great one to start with. So not that just limbic reflexology is good for, fibromyalgia, but it's the one that Hamish started with, and it's where the reflex is. And it's had some really, really good results. So that is where we were looking at doing that. But from a research perspective with complementary therapies, I don't know about in America, but in the UK, there's not much research which is going ahead with or funding or grants for that. But we thought that would be the very best one to start with, and that's why we have, Hamish has been running training courses throughout the UK that we could have limbic reflexologists all over the UK to support this study when we get it going more as well. Yeah, getting sponsorship. And I know it seems a bit
The training now is online. So anyone, I've got students all over the world, but spread out a lot. I think there's about 4 in the US. I think there's about another 3 in Canada, and that's all over Europe and South America. But they're all isolated, if you know what I mean. But the training went on online.
So you pretty much have to have. Oh, go ahead.
Sorry?
I'm sorry, Hamish. I cut you off. So it sounds like you have to have 2 certifications. You have to be a reflexologist first, and then get your.
Oh yes, yeah.
And the additional training.
Limbic reflexology is a CPD course. Yeah, it's a postgrad course. It needs to be, because it's quite a demanding course. It's quite a demanding course.
Yeah, and you did it just because you were bored, right?
Just because I was bored. Yeah, I didn't intend for it to take over my life. It's supposed to be just a pastime. Yeah,
I'm glad
that.
Oh, go ahead.
Yeah, no, I think, and Hamish started, and I did the training I tried first in 2014, but then did the training in 2016. And probably just a bit like you, Desiree, when I was on the training, and then Hamish is talking about, the results and with fibromyalgia and other conditions, and you think, yeah, that's probably because it's Hamish and, obviously his expertise. And I think, and at the time it was 3 case studies, and I had a person with fibromyalgia, 1 person with chronic fatigue syndrome, and I had 1 with arthritis, with rheumatoid arthritis. And all of them had good results from those 3 case studies, but it was the person with fibromyalgia which had the most significance in results, should I say. Wow. And that's again when I volunteered, a bit like Hamish, and volunteered at my local fibromyalgia support group, because it's the same thing. Is it just a one-off, this, or is this consistent? And I can honestly say it's a consistency that you do think if there is somebody with fibromyalgia, I know this can work for them. You do, I think a lot of people, when they come to reflexology, and especially with somebody who's got a long-term condition like fibromyalgia, where, Desiree, I'm sure you've tried so many different things, and you think it works and then it doesn't, or it's just so. I know people do come up to it skeptically, maybe thinking, I'll try it because there's no harm because I've tried everything else. And I think then when they do start getting the results, I call it the light bulb moment. It's just something in their eyes which is like, oh my gosh, this is working. I don't understand it. I don't know how it works, but it's working. And I think that's the case where I'd love this to be on the NHS. I think that's
it's
both
one
of us,
of the
Hamish, we would
reasons
love
why.
it. Yeah.
Yeah, it's one of the reasons why I focus on fibromyalgia specifically, although it's effective for a lot of problems. I mean, when you think of fibromyalgia, you've got anybody with sleep problem, anybody with mood problems, anxiety, post-traumatic stress, ADHD. It's all, effective for those things. But if I went to the NHS and say, look, I've got a wonderful treatment for depression, they would say, no, we've got 10 treatments for depression. We don't need another one. Or we've got treatments for sleep. No, we've got plenty. We can give tablets for sleep, type thing. But if you go to and say, I've got a treatment for fibromyalgia, say, no, there's no treatment for nothing helps fibromyalgia. So if we can show that this, through Marcia's research, we can show that this is very effective, then they might take notice. They might take notice because there's nothing else. Well, there's nothing else on offer. There's nothing else on offer. It's put up with the pain, and you've got it for life. It's tough. There's nothing we can do. But yeah, it's encouraging. It's almost frustrating because Marcia's got this research all set up with universities and things, and we're just waiting for some kind soul to give us some money to help us do it. But it's tough at the moment. It's tough everywhere financially. But yeah, it's when you, as like Marcia said, when you get someone who has been living with, I never say suffering with fibromyalgia, you live with it. You're living with fibromyalgia or chronic fatigue, or ME as we call it here. They've had that for 20 odd years, and they just put up with it. And every time they go to the GP with something, no, it's your fibro. As Marcia said at the beginning, they're not going to believe me. It sounds like I sound like a salesman. This is going to help.
Snake oil.
More likely.
And that's what we were sort of saying is that
fine. Proof in the pudding. And that's why I like doing it at the college, because they don't pay for that. It's free. So they get their eight treatments, and then if they want to continue, because it doesn't cure. It doesn't cure it. I have to say that right up front. It didn't cure it. It helps. It controls it. It manages it, should I say? It manages it so that you manage the problem rather than the problem managing you. It doesn't control your life anymore. But you need maintenance treatments. Generally, 4 to 5 weeks.
Okay.
You'll need a treatment. Yeah. But you
That's
need
not bad.
those 8 to be. You need those 8 to begin with, and you need to be consistently every week or twice a week. Because if it's an accumulative effect, if you miss, say, week 3, you slip back. You slip back. You've lost that momentum. And that's why I always say, look, if you have any holidays or anything planned for the next 8 weeks, then we'll wait till you finish that before we start.
Yeah.
Because it's pointless wasting your time, wasting my time in that sense, because you're just going to do 3 weeks and then you're going to go back to week 1 again.
Okay. So you start all over.
They need to commit. And that's the beauty of doing it twice a week, because life gets in the way. Life gets in the way unexpectedly. So if you're doing it twice a week and you miss a treatment, you're still on weekly.
Yeah.
You're still on the weekly one, so you don't lose that momentum. But sometimes I've had 2 people, the twice a week it's just too much for them. They just feel totally shattered with it. Totally shattered. And a couple of them said, look, can we go to weekly? I can't tolerate twice weekly. So, and they've been fine. But the twice weekly caters for life getting in the way.
And when you said they feel shattered, is it because it takes a lot out of the person when they get the treatment?
Yeah.
Okay.
Yeah. They just feel exhausted with it. Even more so. I mean, obviously, with fibro, you feel exhausted anyway. But it just drains you. It drains you. And you've got to allow for that. It depends if you get a busy life, then you've got to allow it. You're probably better weekly then.
Yeah.
But if you can, you can get that. You can get that control back in 4 weeks, which is amazing if you've lived with it for 20 years. Yeah, and of course, well, as you know, and you probably know a lot of people who have the same problem. You start losing your confidence. You stop social events because you're embarrassed about losing the plot, as it were, the fibro fog. You're in pain all the time. You don't know if you'll be able to go to something, but you don't know what you're going to be like that day. You know you're going to suffer for it later. You're going to suffer for the next 3 days. So they stop going out, so they become socially isolated, they become depressed. And of course, all the things that brings, the sleep problems, the appetite, loss of interest, and all the rest of it. And of course, it just piles on top of each other. And then, of course, they get referred to mental health services when the real problem is not depression. The real problem is chronic pain. And that was the difference, because I used to see people with fibro, they've been referred for depression. And I used to sit there and say, look, I wasn't allowed to, obviously, because I was employed as a mental health nurse. I used to say, look, just give me your feet. I can do a lot more with you if you just give me your feet. And what I used to do, I just say, well, look, get yourself into recovery college. I'll see you there. But yeah, we could help a bit with depression, but pills are not the answer for fibro in terms of depression. So yeah, it's life changing. It can be life changing. But it's the same with ME. Do you call it ME in the States? I think you call it chronic fatigue, don't you? Chronic fatigue syndrome.
Chronic fatigue. Chronic fatigue syndrome.
And here we call it the myalgic encephalomyalgia. I think in the States, because there's no, they can't identify a problem in the muscle, so they won't call it myalgia or something. Anyway, it doesn't matter. But it's very, very similar in terms of the pattern, as I mentioned, and the feet, very similar. The results are more or less the same. But what I found is that with chronic fatigue, they don't need the maintenance as much. They don't need the. In fact, I've had several who have really not had any maintenance, and I've contacted them 2-3 months later, and they're fine. So it seems to reset something. But obviously it's a different problem, because it's all to do with free radicals and chronic fatigue. It's not a fibromyalgia problem. But yeah, so the pattern is exactly the same, apart from 2 signature differences and almost diagnostic signatures in chronic fatigue. Because I've had quite a few who are referred themselves for fibromyalgia. I said, this feels more like chronic fatigue, and they've gone to rheumatologists, and yeah, it's been chronic fatigue.
So you can feel the difference in the foot, like
you can feel the difference. You can feel it, and it's quite distinct. But I can't go around, and no reflexologist can go around saying that you can diagnose. We can't say that. All we're allowed to say, it may help with stress. That's the limit of what we can say. It may help with stress.
And that is why.
So officially, that's what I'm saying. It can help with stress.
And that's why, for me, the big thing is to do the research. In limbic reflexology, because that's the being put under the same conditions as any new medication would be, and until it's up to that scrutiny, until it's up to that scrutiny, then we can say whatever we want to say, even though the clients,
if you've got scientific research showing it does help, then you can start saying it does help. But you can't say that until you get the research. So it's very frustrating in that sense.
And I think that's it.
Because I get people contacting me through the website saying, is there a limbic reflexologist near me? I could help. This would really help me. And if there's no one near, what I say to them, I said, well, if you've got a reflexologist already, or you know one, get them to do the training, even if it's online. And sponsor them to do the training, because they have to do 2 case studies. which is 8 treatments in that sense for each of them. So if you sponsor them to do the online training, then you swap that sponsor for 8 treatments. So it's a win-win situation.
It is.
And that's what I say to anyone throughout the world. So, if you're in contact with reflexology, sponsor them to do the training. They will gain skills in doing it. You will gain help, and you'll have a ready-made reflexologist on your doorstep. So it's a win-win. Of course, I win as well.
Well, 3 people on there. Well, many patients.
That was a salesman. Yeah.
No, I like that.
It's a sensible solution, because not everybody obviously can come to the UK. I've had 2 from the States come over to do it. Quite a few from France come. Belgium. I've had a lot come from Belgium to do the training in the UK. I've actually been to Belgium once to do the training, and France. But apart from spending my life touring the world, which I don't want to do, I'm getting too long in the tooth for that, and I've got too many other interests. The online is a solution. And people that have just done the online training and not attended a workshop are getting the same results.
Wow.
Because the online, there's video tutorials how to do it, very detailed video tutorials, and there's a lot of support as well. So they can contact me anytime if they want to know any clarification or anything. So if any of your listeners with fibro or chronic fatigue or whatever are interested, then get your local reflexologist to do the online. So you can do it anytime.
And how long do these treatments last? Oh, go ahead.
The treatments last about an hour.
An hour? Okay.
Generally 45 minutes to an hour. I can spend an hour and 20 minutes if I want to, if I really want to get into the nitty-gritty. But generally an hour. And that's purely on the big toes.
Oh, only on the big toes. That's it.
Yeah. The limbics on the big toe, spinal reflexes, and the adrenals, and that's all you need to do. That's all I do with all my regular clients. Is all I do is the limbic. I don't. If they've got, say, painful shoulder or something, I might do the shoulder, but pain is in the brain. Pain is not in the shoulder, and some people can't get their head around that. We experience pain in the brain. We don't experience in the leg or anywhere else. And of course, if you want to dispute that, just say, well, have a local anaesthetic. Basically what you're doing is stopping that signal getting to the brain, and you don't feel the pain. So the pain is felt in the brain. So if you work on the brain, you're actually, dealing with it where you're experiencing it. And it's sometimes it's counterintuitive. It
is.
You've got a pain in your knee or something. No, your pain's in your brain. That's where you experience brain. Because if you have a spinal block, you don't feel the pain. Basically, the spinal block, all it's doing is stopping that pain signal getting to the brain.
Yeah, the nerve signals.
The injury is still there, but the pain signal is not getting to the brain. So if you can work on the brain, in limbic reflexology, working on the brain and the pain pathways, then you're helping. You're not actually changing it. And what you're doing is you're helping the brain get back to its normal functioning.
Because it's like almost an overdrive.
That's it. Yeah. And I think part of the response or the reaction to treatments you mentioned earlier on, part of that is when you remember I mentioned about everything depending on each other in the brain. When you alter something, because the brain will adjust to compensate. Okay, but when you alter something, you're throwing everything else out of balance then, because it's in a compensatory state. So it takes time for everything to get back to recalibrate, as it were. Everything get back to normal. Everything get back to a different setting, as it were. Pains in the brain. So
wow. I guess that's why.
Sorry.
Oh, I was and that's probably why if you miss a session, that you have to go back to the first because
the
brain is trying to
fall back into the compensatory. So it has to. It needs time, but it will. The changes will happen very, very quickly, very, very quickly. But because it's a series of changes that have to happen for everything else to catch up, to get recalibrated, and it does take eight. It does take eight to make it stick, as it were, to make the changes stick.
So is this for life?
The reason why I'm saying eight, because the eight is what I found when I was developing.
Okay.
If I did 6, they fell back. Sometimes 1 or 2 were fine at 6 and stayed okay, but most of them between 6 and 8. So 8's a safe bet. Go for the 8, and you're going to cover all the eventualities. Okay.
And I was wondering, do y'all do the same patterns, like on week 1 and week 2 and week 3?
Yeah.
Or is it like I do this week 1 and I do this week 2?
No. You cover the same things. And what you'll find is when you do the first treatment, you cover every single limbic reflex area, and I'm talking about 30 odd on each toe. So that's why it takes the hour. And what you find is a pattern, and one thing some things will quieten down, and some things will be constantly there, and so you can focus more time on those things that are sticking. Okay, I think those things that are resisting change. So you become more refined as you go through the 8. It's almost like a funnel. You start wide, start doing everything, and then you start to focus down on where the problem's sticking. Quite often, one of the problems that it does get sticky is a sleep problem. Okay, that's usually the last one to resolve, if it does resolve completely. The sleep problem, the first one, interestingly, the first 2 that improve is depression and anxiety. The first scores that come down quite dramatically is depression and anxiety. And of course, that has a huge impact overall. Because if you're no longer depressed, you're starting to get interested in what you used to be doing, you're starting to go out a bit more, then that will help. It gets momentum going. So depression and anxiety quite consistently are the first 2 that it helps, that it improves. So
I'm interested in what I mean, y'all must have really sensitive fingers. Y'all must have really attention to detail and sensory type of touch, because you're I mean, that's what you're working with. You're working with your hands.
It's interesting you say that, because my right thumb and my right index finger have a lot better effect than my left hand. If I'm feeling something in my left hand, I think there's something there, I always check it with my right hand. And the same with one of the techniques is that we I can't really say, we can rest and breathe. If something's really, really tender, that you don't want to be whacking it, but it's quite cruel, as it were. So one of the techniques is rest and breathe, and just half pressure, no pressure, half pressure, and that finger, I can feel the energy in it. Others I can't, and it's an individual thing. That it's an individual.
I'm not
Every
sure.
reflexologist will feel different things.
Because
but it's
I'm
something you
right-handed,
develop.
and
I can't explain it. I could try explaining it, but I can't. Okay, and it's like lots of people try and explain how reflexology works. I don't. I just say, well, it's one of life's mysteries. Okay, it's magic. It's magic until it's explained scientifically. We'll call it magic. Okay, but lots of people try to explain it. I thought you're just speculating. Just call it magic.
As we said,
we're
not diagnosing or prescribing. We're just seeing what we feel, and
we're just working with what we find.
And if we do,
what we find.
And that's it. If things are showing up all the time, then you know, you'd be mentioning it to that person. And I mean, there's been times when I've sort of said something's showing up on an area, and it's like, go and see your GP or your doctor, because there's something showing up. So that's best to get that checked out. I'm not going to say it's this, I'm not going to say it's that, or you definitely got this, because we don't diagnose. So yeah.
And you fell into this accidentally, Marcia, right? You were in IT for 25 years.
Yeah, so I was, it was really my children, and my youngest, my son has a disability and a lot of health problems when he was young, and he was in and out of hospital. And I was just wanting to find something which was not medication, any additional medication. And before I'd done an evening course in reflexology, when I saw these things on reflexology, and I thought, right, I'll get qualified. But I thought I'd be just doing it for my children and some friends, and I was enjoying my IT. But over time, the reflexology took over, and I think it is because you see the results that people are getting instead of being on a computer. And I still blame Hamish, because I was going along fine. I was going along fine until 2016, and now I've got in this head, and it just won't go away, because I know there's the potential to help so many people. And that's just a thing that's, if you know something can work, you want to bring it out more and more to the world. And that's where we are. So I'll speak to anybody about limbic reflexology and research. And indeed, I've done numerous interviews over time, but it's just to get the word out more and more. So Desiree, when you got in touch, I just thought, you don't just need me, you need a Hamish here to actually explain everything, and that I'm still the novice, I believe, when I compare to Hamish, but I work with people, but for me the big thing is to do the research, and that's why I went back to university and did my Masters of Research, because that's the important thing, is getting this out to a wider audience. That's all I can say.
That's amazing.
We're very lucky that Marcia's got a research background. I couldn't do the research bit. I couldn't do the research. I could have a good stab at it, but you need to know the roads in amongst the research, because it's a minefield for me. I'll leave all that to Marcia. But yeah, it can be. It's like Marcia said, it can be quite addictive when you see the results. It's quite addictive. But yeah, I mean, and in terms of the research and the focus is on fibromyalgia for the reasons we've mentioned, because it's going to get noticed more. But there's so many other things that can help. I mentioned ADHD, but helps for that. Post-traumatic stress disorder. Again, there's very specifically brain pathways that are involved in that, and I've just had a case study back yesterday, a guy from Antwerp, who's had huge results with post-traumatic stress. So but the thing is with limbic, I could teach. Well, I'm saying I couldn't teach a monkey, but you could just teach them that do this, follow this routine, and you'll get a result, and they probably will. And the fact that students in the first 8 weeks after actually doing the training, and it's quite a demanding course, are getting results. A lot of them have no idea why they've got results, because they haven't gone into deeper. But it's when you go into it deeper and look in the neuroscience articles and discover, oh, that's what I'm doing, that's why it's working, that's why it's, if you look up an article on sleep, for instance, or chronic pain, even though you got the result, you're not quite sure what you did. You're not quite sure what you did, but you do that routine, you will get a result. But what the satisfaction comes from when you actually do the research into any condition or problem, And you say, oh, that's why that was tender. That's why that was tender. Because I still get that after 13 years. I thought, well, why is that tender? And I dig into NCBI is the website, and look at all the academic articles are listed there, and you can read them. I can go through, say, 10 articles, and I find that's why it's tender. It relates to that and that, because it's so complex. And we're not neuroscientists, we're reflexologists.
Yeah,
but it helps.
But
it helps
so
if you can
much
understand.
Connected.
It helps if you can understand why you got there. Okay, although you don't have to, you can still get results, but it makes it much more rewarding. And of course, you can fine tune your treatments, because you think, well, that regulates that, and that regulates that in turn. So work that and see if that works down the system, works down the chain. And sometimes that's what it is. It's like two regulations back that the problem is. If I was working the habenula, then that regulates the VTA, which regulates the dopamine to the nucleus accumbens. Whereas you can work with the nucleus accumbens and say, well, that's not what the problem is. The problem is in supply chain. Okay, so if you know that, you can go back. And that's why it's quite a demanding course, but not that demanding. Okay,
right.
Everything you need, all the neuroscience you need is in the book, is in the textbook, which is in Amazon, or on the course material and the online. So it's all there. Everything you need to, if you want, and it's much more rewarding, is you can delve deeper. And I'm still delving deep. And it just fascinates me what your feet, because your feet never lie. Feet never lie. Sometimes you don't make any sense.
I can't say anybody said that before.
You're going to think of your feet differently now, aren't you?
Why is that? That shouldn't be tender. And then when you delve deeper, that's why it's tender. The feet are telling you. If you listen to the feet, you will tell this whole story.
What did you say, Marcia?
It's fascinating.
No, I was just saying that you'll think of your feet differently now, and I think that's it's working. It's working your feet.
Yeah,
and just seeing what comes up.
And it's all connected, like you were saying. You start everything like it's almost like a domino effect. You go to the next domino, and then the next domino.
Exactly. And sometimes, as you said, you have to trace back, find where the problem is. It's like an electrical circuit. It's not the actual thing that's the problem. It's that connection there, it's that diode there, it's that transistor there, whatever, capacitor, whatever. So you have to trace back to where the problem is. And the feet will tell you what it is. The feet will tell you what it is.
It is. And I want you to touch my feet.
It is completely fascinating. I can, if you get fibromyalgia, then I can more or less tell you what ones would be tender in your feet. Yeah. Have you had fibromyalgia many years then?
Yeah.
Have you lived with fibro for a while?
For a while, I would think at least 15 years.
Sorry, at least for?
15 years.
15.
I've lived with fibro. Yeah. I mean, it just got diagnosed not too long ago, but I felt like this for a long time.
Such a common story. That. Yeah. I've had the problems for 20 years and been diagnosed 3 years ago. Yeah. It's so common, that. So common. Because it's a diagnosis of exclusion. They say, well, if it's not that, well, it must be fibro. Yeah.
Yeah, pretty much.
It's a shame that people have to go through those years of suffering to get to that. Of course, that doesn't take it away, obviously, but it helps knowing what it is. So so you need to find a limbic reflexologist.
I'm going to. Yeah, and if I don't find one near me, I'm gonna try to get them to do your course.
Do the course. I mean, it'll take them a few months to do it. As I'm saying, it's not, and I say that on the website. It is a demanding course, because I don't want people to come on the course thinking it's a weekend course, and it's not. It's not a weekend course. You need to make that commitment, because I have had people come on the course. They've got another course booked in 3 weeks' time. I thought, well, forget it. Save your money. Go and do a course that's easier. Don't do one.
I know you mentioned ADHD and RA.
ADHD is very specifically a brain problem. It's very specifically a brain problem because you've got the impulsiveness and you've got the pure concentration type thing, which is two of the main things.
Are you saying about
and
ADHD?
That's down to dopamine. I've been seeing a lady with ADHD as an adult for just over 2 years, and it just keeps her right.
And as far as these different diagnoses, do you do it intake form and find out what's their problem and then go from there, or how do you work when a client first starts working with you with reflexology or limbic reflex?
Usually they come to you with the diagnosis, and then you have to unpick that. Because, as I said before, we don't. I know what reflex areas to work for sleep. There's about 5 reflex areas to work for sleep. I know what to do for motivation, for loss of pleasure, a lot of interest. Okay. I know what to do for appetite. Okay, so you have to break the problem down break the diagnosis down into what problems. And of course, 2 people with depression will come with different presentations. Some people might say that the sleep's the big problem. Other people might say, I'm just not interested in anything, or low mood. Okay, and they might come with totally different emphasis if you want. But you've got to break it down into what problems. But people don't come with you with a problem. They come with their diagnosis.
Okay, gotcha.
They come with ADHD, or they come with, anxiety is a little bit more straightforward because anxiety is anxiety. And you have to break it down into those components so you know what your treatment plan will be.
Okay, that's interesting.
The feet will tell you what the problem is. The feet always tell you.
And I have a couple more questions. I know Marcia mentioned that she is very helpful in working with, giving treatment to their feet. But when they go home in between sessions, she tries to show them on their hand. So what's the difference between working the hand and working their foot? Well,
I'd still be looking at, I suppose, in a sense, more relaxation when they're actually home. So I could show them relaxation tools to work with their hands. So it's working with there. So I don't particularly do much hand reflexology. As I said, it's just certain points that I would be showing them what to do. If
gotcha.
they had pain or a relaxation, and it's also I also help with their mindset and how they will, just from the first aid and mental health perspective, it's working on their mindset as well, and so looking at their sort of working holistically. Basically, it's not just working.
Theoretically, you should be able to do it in both hands and feet.
Yeah.
But when you look at limbic, it's quite difficult to do it in the hand because obviously the thumb is a lot smaller than the big toe, and these are very precision reflex areas. So you can give them kind of general stuff to do in their hand, but you certainly can't do it in your own toe, not unless you're very, very flexible. But yeah, and of course my thumbs are quite big as well. So if I did it in somebody's thumb, it'd probably cover half the thumb. Whereas trying to find 30 individual reflex areas in the thumb is a lot more difficult. But yeah, theoretically, they'll all still be there in the thumb. But don't forget that the toes are much more sensitive. It's much more sensitive because the thumbs use so much. Yeah. It's not as sensitive as the toe.
Yeah, that makes sense. Thank you for explaining that. And I think that was one of my questions, like, can you do reflexology on yourself? And it sounds like you can. I mean, do y'all do reflexology on yourselves? No.
No. No, I've got a wife that does it with me. No, it's very, because you have to be relaxed. and it's almost impossible to be relaxed and walk in your own feet. Yeah.
And
certain points, I'll just be certain points because I run as well, so I do certain points that I will know, sort of like referral areas. So if my knees, I work certain points to help with that. Yeah. So that's about
I will do it if I've got, I will do it if I've got a sore shoulder or a neck or something. I can do it on my toe, but it's a very generalised. It's not very specific. You can work on it and you can find where it specifically is. You can tell, right, it's C6, it's the problem. So you can tell that on your foot. But, I don't think for limbic, you wouldn't be able to do limbic.
No, I wouldn't. I don't think of doing limbic on the hands or showing anybody on the hands.
It can be quite tender, limbic. It can be quite tender. So in a sense, it'd be nice if you could do it, because you could do it to the extent you can tolerate it. Sometimes it can be really quite painful.
Yeah, like you said, you have a lot of people that have the sessions, one session a week with fibromyalgia. That's all they can take because it's pretty intense.
Yeah.
If you can share, Marcia and Hamish, this will be the last question. I really appreciate your time. What is the most remarkable patient or case study you've worked on?
Marcia?
Actually, it was the person that fibromyalgia. I think it was that we had a conversation. I could tell you exactly, Hamish, where this conversation was. I was travelling and seeing family, going back to home, which I'm based in Scotland, and I was having a phone call with Hamish, and Hamish was saying about, going from the 6 weeks and doing, if we could do 2 sessions a week, that would be really, really good, he said. And I remember going back, I advertised, and this person came, and I said 8 sessions, and she was definitely wanted to do twice a week. And the results, we did the questionnaire, and the results were just unbelievable. And I think it was literally in 8 weeks, she was just like, I don't believe it. I actually honestly do not believe what's happened. So I think that was the first one. That was the most remarkable from there. But it's had that before, but I think that was the first time when I did 2 sessions a week. So you 4 weeks then, and this person went from all this pain to, not feeling that pain. And I think that was the biggest thing for me, and that's when I thought, no, I've definitely got to try doing something.
I think it's not so much in terms of score improvement. I would say, because it varies to individuals, it's what it means to that person. If it changes their life, even if it's not, the best result ever, it's the amount that they change to get their life back. Because you lose so much of your life because it's controls what you can do, what you can't do, when you can do it. If you get that control back, that's the biggest bit. I know I've been seeing people for 8-9 years regularly, and they'll say to me, I just can't do without this. It just changes my life so much. And that, for me, is a huge reward. It's just to hear that. They also say, well, what would it do if you weren't around? If something happened to you, who can I go to? I thought, thank you very much. Yeah, but there are people around. There are people around I could pass them on to. But yeah,
but it's the management. Yeah, it's the management, and
it manages. And as you said, it helps them manage their life.
And it's not.
I think it's a life, but they can do things they want to do when they want to do it, without if I can do it, if the fibro lets me, or if the ADHD lets me, then. That girl I talked about, she's gone to university now. She wouldn't have been able to do that before.
Yeah.
She was having non-epileptic seizures and all the rest of it. They all stopped. It was non-epileptic, it was stress thing. But yeah, she's gone to university, doing very, very well, being able to concentrate and everything. So,
that's amazing.
Just 40 minutes every 4 weeks.
And to me, that's worth it. To gain your, like you said, gain your life back. because you are with chronic illness, revolving your life around this chronic illness.
Yeah.
So
it's the same with any chronic illness, isn't it? It's the same with any chronic illness. It controls your life. But get that, and of course, well, that's fibro. I mean, every person with fibro is told that, well, you've got this for life. It's not going to improve. It's not going to go away. And which is true, in a sense, is true. But they don't offer you anything to manage it, not effectively anyway. If you say, well, here's something that you give you control back, have this treatment every 4 weeks, you can go about your normal life. That's huge.
I think huge. Desiree as well. I mean, I do not have a chronic pain condition, but I think the difference between, and I'm not saying, again, it's a complementary therapy, so you're working towards, you're not saying one or the other, but what I'm saying is, if we look down the route of just medication, and I'm not saying that's it, but for some of the medication, it is the long-term effect of that medication, which then starts causing lots of problems in the body. And that's the and I think sometimes that's the problem. If you may have to do both, but then the research is, with full fibromyalgia, the research is showing that not just down the medication route, it's because the side effects now kick in, and there's not the evidence to say long term this is where we should be going. And I think that's the case, and that's the thing to think about. So the medication may not help, but it's the long-term effect. So Hamish was saying he's had some clients for 8-9 years, but if it's just a medication, it's the potential side effects, all those that nobody is thinking of, and I don't know where that research is that I've seen to say this is, and the current research is not showing that.
To be fair to medics, they've got nothing else to offer. Because they have to go by what in the UK what NICE says that they can offer. NICE is the kind of governing what can they spend, that thing. But that's all they can offer. If we get the research underway, then there's potential that the GPs can refer for reflexology as well as medication.
Yeah,
and possibly less medication.
And that's
possibly
what it's
less medication.
Yeah, not
whichever
alternative,
combination suits
complementary.
them. Yeah,
complementary. I think that's the thing that's the key.
Well, a lot of like for fibro, a lot of medication has got the side effects and put on a lot of weight. Like the gabapentin and pregabalin put on a lot of weight, which just makes the problems worse. Makes the problem worse. I mean, probably more. I think in the States, the what you call it, the license in the States, and I can't remember the life of me what it is. It's an antidepressant, basically. It's a combination antidepressant, and that seems to be helping a lot here as well. That's it. Yeah, duloxetine. Yeah. But again, the same with NSFRI, because it's a combination SSRI and NRI. They're not quite sure how it works. Not quite sure how it works. They know it helps.
Yeah, it's sad that we go towards medication rather than trying these complementary alternative things or therapies first, because you could get a lot further and lessen to where maybe you won't need as much pain medication or medication period.
But the same talk, I can understand why I need research, because it's protecting the public.
Yes.
Protecting the public.
That's true.
They've got to have something that they can show that is a valid, because there's a lot of scammers out there. Going to say this works and that rest. Give you your money and bye. Yeah.
Which is why wanting to put it up to this.
Marcia's research underway, we can get on the road.
Getting that scrutiny as I said, in the same space of that medication, any new form of a pharmacological intervention would be. You want it at a plain level, playing field. So you're not saying, this research in limbic reflexology, but it's not held up to the same scrutiny as something else, because then that doesn't work. It's got to be thorough, and that's where, I mean, that's what, I don't know, it sounds sad, but that's what resonates with me, and that's what makes me want to do this more and more and more, is because, as I said, once we get the research, it's just that it opens it up, the potential for limbic reflexology and potential for indeed complementary therapies in you know, as a whole, because it looks at it. I mean, I don't know about in America, but and I know during the pandemic that was a little, you know, it was unknown what was going to happen, but we complementary therapists were literally shut down.
We couldn't do anything.
We couldn't do anything,
Yeah,
even though we're the close contact, but we're on fetal mask and everything. We couldn't, so we were completely shut down because I think where complementary therapy is seen, whereas we would be helping the profession, medical profession, not hindering the profession, because and I think that's where it is. I again, I keep sort of the comparisons, but in the UK, you'll see lots of reflexologists in you know, during for cancer, for patients, they'll be seen there, but not really in any other space, medical, unless you're Hamish and you know, you're at the recovery college. But it's usually a shut door to get in there, and I think it's, yeah. I could go on about that, but I won't, because I'm looking at the time.
We'll get there eventually.
We'll get there. We'll get there. Hoping.
Yeah. Well, I appreciate you opening the doors and doing the research and doing the background work and starting all this, because it's giving so much hope to patients, to chronic patients, whether it be depression, anxiety, to post-traumatic stress syndrome, to people that have autoimmune disease and cancer. I mean, it's what we need, and we need to stop looking out, just, you know, we need to look outside the box of, okay, obviously these medications aren't doing the job. Let's try other things. And y'all are offering that. So thank you.
It's whether it's available, and that, you know, the more, I think there's about 200 at the moment. It's growing, but you know, the more people are out there that are trained in it, the better.
Yeah, better for me.
Yes.
Need some people in Texas.
Yes.
Well, thank you so much. And anything you want to add before I let you go? And because I know it's late where you're at for both of you.
Thank you very much for the opportunity of getting it out there. Getting it out there to a wider audience. Yeah.
Thank you.
And you've got our details anyway, so it's all good. Yeah.
Awesome. Thank you so much.
Okay. Thank you.
I hope you enjoyed the episode. As an autoimmune coach, I know what you track on a daily basis makes a big contribution to your symptoms and flares. If you're interested in a free tracking app, go to Isla Health. And like you, I've been hearing a lot about the health benefits of mushrooms lately, but don't care too much for the mushroom coffee. That's why I started taking BioVale Myco from Adapt Naturals. It's a blend of 8 mushrooms, including reishi, chaga, lion's mane, cordyceps, in a convenient capsule form. I get the benefits of mushrooms: more energy, sharper focus, and stronger immunity without having to give up my delicious Java. For a limited time, the folks at Adopt Naturals are offering my audience 15% off their first order. So just go ahead to adaptnaturals.com/DEZ15 to learn more and get started. Until then, stay stronger than autoimmune.